Agoraphobia is an anxiety disorder where an individual has intense fear for and avoids situations that may cause panic and or be difficult to escape. People who suffer from agoraphobia have an intense fear for large crowds, large lines, enclosed spaces, public transportation, and open spaces. The term agoraphobia derives from the Greek word agora, which means market. Agoraphobia was first introduced by German neurologist and psychiatrist Karl Otto Westphal. Dr. Westphal first introduced agoraphobia in 1872 when he wrote his book titled Agoraphobia, a Neuropathic Phenomenon. In his book, Dr. Westphal explains his experiments with agoraphobia and how it affected a patient's way of life. Dr. Westphal explained that patients with this disorder were not able to walk over certain streets and places, and these fears limited their freedom of movement. Physical symptoms of agoraphobia are rapid heartbeats, shortness of breath, sweating, feeling sick, chest pains, dizziness, faintness, vomiting, chills, and upset stomach or diarrhea. Mental symptoms of agoraphobia are loss of self-esteem and loss of confidence. There are three potential factors as to why an individual can develop agoraphobia. These factors are environmental, genetic, and temperamental. Environmental factors that may cause an individual to develop agoraphobia would be experiencing a crime, abuse, or a traumatic event. Some examples of these would be getting robbed, attacked, raped, domestic violence, death of a parent, and many more. A genetic factor would be inheriting agoraphobia from a blood relative. A temperamental factor would be that some people are more prone to anxiety-related disorders than others. There are 5 treatments that effectively fight against agoraphobia. These treatments are exposure and response prevention therapy, cognitive behavioral therapy, systematic desensitization, drug therapy, and relaxation techniques. Exposure and response prevention therapy involves a patient being exposed to their greatest fears and avoiding any responses that they would typically have. Cognitive behavioral therapy is used to reverse negative thoughts and promote healthy behavior. Systematic desensitization involves a patient gradually being exposed to their fears in order to desensitize their responses to the fear. Drug therapy involves using antidepressants and anti-anxiety medications in order to help agoraphobia. Relaxation techniques include deep breathing, active relaxation, stretching exercises, visualization, passive relaxation, yoga, and or biofeedback. The treatment that is most effective for treating agoraphobia would be cognitive behavioral therapy.